Hello, my name is Heather LaForce. I'm doing my presentation on the ethical concept of mandatory vaccinations for the Department of Nursing at Saginaw Valley State University. This is for Class 644, Nursing Leadership and Ethics, with Dr. Marcy Welker. So why is vaccinating important? Vaccinations are a highly effective, safe, and easy way to prevent disease and strengthen the immune system of the person receiving them. Vaccine-preventable diseases can cause long-term illness, hospitalization, and even death. Vaccines prevent outbreaks and epidemics from occurring throughout the world and have even eradicated diseases such as smallpox. Following recommended vaccination schedules is the best protection against vaccine-preventable diseases. Vaccines do not only protect those that are getting vaccinated from diseases, but they also protect diseases from spreading to others. A quote from the CDC, vaccination is a critical step in protecting those that are most vulnerable to illness. That would include infants and young children, the elderly, and those with chronic conditions and weakened immune systems. In the state of Michigan, there are mandatory vaccinations. Those would include mandatory child vaccines, and some healthcare facilities require their healthcare workers to receive influenza vaccines. I think it's a very interesting topic to think about mandatory vaccines. That's why I wanted to write my paper on it. There's definitely ethical issues that need to be considered when we're discussing mandatory vaccines. So I will be going through that in my presentation today. So mandatory child vaccines. Many vaccine-preventable diseases can easily spread among children in certain close contact settings, such as group programs, schools, preschools, and daycares. Because of this, it's important for children to get their recommended vaccines as a standard of care to prevent outbreaks of those vaccine-preventable diseases. There are groups that are high risk: students, teachers, especially children who can't get vaccines, possibly those who might have children that have cancer. So that's why some states are requiring certain vaccines for children to enter these settings. And again, that includes the state of Michigan. There are times when a child may be exempt from getting required vaccinations, and that would be for a medical or a non-medical reason. So they're broken up into groups. If there's a medical exemption, then the child's healthcare provider would sign a medical waiver identifying what that medical reason would be. It's indicating that the child cannot receive a certain vaccine due to a true medical contraindication or precaution to the vaccine or a vaccine component. The provider must also document the refusal for vaccination of that child. If there is a non-medical reason, it's usually religious or philosophical. And if someone is looking for having a non-medical reason for that child to not get their mandatory vaccinations before entering those group settings, then the process is they contact their local health department and they set up to meet with a nurse or a health educator at the health department, whoever it may be, whatever the process is for that health department. And they're required to go through an education to get a vaccination waiver form. So these non-medical waivers are certified by the local health department that the individual received the education on the risks of not receiving the vaccines being waived and the benefits of the vaccinations to the individual and the community. There was a qualitative study that was conducted using this normalized process theory to assess the process of the parents or guardians going to the local health department to get the vaccine waivers in Michigan. This getting vaccine waivers is a newer process, so that's why this study was conducted. They changed the rules in 2015. So they wanted to look at, there was a study done because they wanted to assess the process to see if this program was going to be sustainable and something that they thought would make a difference. So the study was conducted to identify areas of weakness or improvement for success of the program, since it's dependent on inconvenience to getting waivers to increase vaccination rates. So they're trying to add an inconvenience to the families, essentially, by having to go to the health department and get this education from someone at the health department, and adding the inconvenience in hopes to make it not so easy to get those waivers, and that more people would just get the education and then be able to ask questions, and maybe they can change their mind and get the vaccinations. So I think that's a really good thing. So the study that I'm talking about was conducted 32 interviews. This was in Michigan. It was with 32 interviews of parents or guardians that were getting waivers, and this was at 16 local health departments, again in Michigan. So this normalization process theory consists of 4 components: sense making, engagement, collective action, and reflex monitoring. And what that means is sense making is looking at those who are delivering the services, that they understand their role and the role of the stakeholder. And the stakeholder may be the school, the family, or the guardian, the parent, whoever's coming in, their role as the health educator or nurse at the health department. So that makes sense to them. Engagements involving stakeholders in planning of program initiatives. Again, that might be schools, or maybe MDHHS, or people in the community. Collective action is those who are implementing the program or working towards a collective goal. So that's the collective action. And then reflex monitoring is staff are creating insights on the initiatives and the usefulness and effectiveness of those initiatives. So the results found after those interviews that there was a lack of understanding in who the stakeholders were in the program, and a lack of engagement from those stakeholders. There was a consensus that education was the goal of the program, but there was confusion on the collective action. And that study also found that there was rarely reflex monitoring done so that they could look at improvements of the program. So showing that essentially they weren't sure if the program was going to be successful and that there needed to be some work done. So taking into consideration what that study found to, again, improve the program, since it's so important about education to increase vaccination rates. Mandatory healthcare worker vaccines. They're imperative to protecting those most vulnerable to illness, and that's why many healthcare settings are mandating their healthcare workers to be vaccinated, especially for influenza, to prevent those, possibly hospital-acquired vaccines. Maybe your facility or facility you've worked with has had this kind of policy, or you've experienced this firsthand. A review of United States hospitals with mandatory vaccine policies found that such policies improved vaccination uptake from 64% to over 90%. I reviewed an article from the American Journal of Nursing, and it discussed and supported mandatory influenza vaccines for healthcare workers with informed refusal. So their stance came from knowing that unvaccinated healthcare workers pose a threat to public health, and that data from studies in Scotland, Canada, and the U.S. suggested between 14% and 37% of healthcare workers become infected with influenza virus each year and spread the illness within their facilities. The article discussed herd immunity and how it can be acquired through vaccination of all staff. That's why they were supporting the mandatory vaccinations for influenza. They also discussed an increase in absenteeism within low vaccination rates that ultimately affected patient safety due to low staffing. They talked about illness and symptomatic healthcare workers pose a threat because then they also expose patients to the illness. And it also said that it affected cognitive functioning of the nurses because they were distracted and they were sick, coming to work sick. The article also stated that the reason healthcare workers give for declining influenza vaccinations consistently includes a lack of knowledge about the vaccine, doubt about its safety and effectiveness, dislikes of injection, fear of adverse effects, inconvenience, and limited support from leadership. I didn't necessarily want to put my position on mandatory vaccines. This was more me kind of researching to continue to, I guess, formulate my own opinion. So I wanted to just discuss some of the ethical principles that were affected by mandatory vaccination, and first and foremost, autonomy. So autonomy is the ethical principle that represents the right of a rational person to express their personal decisions that are independent outside of interference, and to have those decisions honored. So with mandatory vaccinations, it absolutely can be argued that mandating someone to be vaccinated is not giving them the option to make that decision for themselves, and for that decision to be honored. And so it is infringing on an individual's autonomy because it's not giving them that option to decide for themselves. So that's definitely one ethical principle to consider. Non-maleficence is the ethical principle of obligation to do no harm. An article from the American Journal of Public Health argues that mandatory influenza vaccine does not harm the patient's well-being, and vaccination against influenza should be mandatory because practicing without vaccinations is maleficent because it falls below the standard of care. So as you can see, there's kind of a theme from a lot of the journals of public health, the American Journal of Nursing, that they're supporting mandatory vaccinations. And I think coming from a public health standpoint, I can definitely understand that. But again, take into consideration the autonomy of the individual. Beneficence. So beneficence is the ethical principle where people take action to benefit and promote the welfare of others. When a healthcare worker gets the influenza vaccine, they're taking action to promote the health and well-being of their parents, and they're reducing the transmission of the influenza virus to their patients. I did do an interview with a nurse leader on the ethical considerations of mandatory vaccines, and she stated that there's several facets to consider on this topic. She said from a public health standpoint, again, I agreed with her. Her first thought is that you should have mandatory vaccinations, but because they're an opportunity to do the greatest good for the overall health of the population. But again, you must consider the individual's rights should always be considered, and that everyone has the right to refuse a treatment or procedure and not have their body invaded. She stated giving vaccines against a person's will would be making vaccines mandatory for all against the will of some. She did recommend continuation of strong promotion and education of vaccines and their benefits throughout the community, and that needed to continue to occur, and that would include to those who have religious, medical, or non-medical reasons to not vaccinate. So in summary, there are several ethical considerations that need to be taken into consideration in relation to mandatory vaccines. Vaccination education is a key component in decision-making for vaccines within healthcare workers, healthcare facilities, also for parents and guardians for their children. Mandatory vaccinations in children and healthcare workers need to consider autonomy of those who are getting the vaccination, doing no harm, and then promoting the welfare of their patients, or maybe their family or the community even. There is a need for increased research. I had a lot of trouble finding studies on this topic, so I really do think there needs to be an increase in research on ethical considerations and the effects of mandatory vaccines on healthcare settings and children, but I think also just throughout the community as well. Maybe, you know, especially now with COVID and essential workers, I think that we're seeing as pandemics are spreading and COVID spreading, we're seeing how people interact and how diseases can spread. And I think that maybe there's in the future consideration of mandatory vaccinations, not just in healthcare settings, but yeah, maybe essential work sites or something. I'm not sure. We're definitely learning a lot right now. And there are their references. Please feel free to reach out if you have any questions. Thank you.